Dear viewer, good evening and welcome to Spotlight. With me tonight, the Director of Community Health and Research Center at Access, Mona Makki. Hi Mona, welcome to MEA.
Thank you so much, Wally, for having me.
Sure. Mona, let's talk about the clinic that Access been holding, giving vaccine to the community. When that start and is still on, or when is going to end?
So we were a part of the state pilot project, the SBI awardees to provide COVID vaccines to vulnerable community members, and that started in March. So since March, we have been providing ongoing vaccine clinics here in the location in Dearborn, Michigan on Maple. We also held a vaccine clinic at our Salino Court location as well.
And the original one.
Yes, and at Sterling Heights last week as well. So we've been active providing these vaccine clinics, trying to make sure that folks have the information, and the way we did it is we have walk-ins. We wanted to remove all barriers for folks to make it as easy as possible.
Yes.
Looking at language barrier, looking at the technology, just having to register. We found that was for some people it was a challenge.
Absolutely.
And so, yes.
Yeah. Are you doing it by the Access by themselves or join with many different organizations?
So, as I mentioned, we received the pilot project, but we also have partnerships where we partnered with Meyer at our main headquarters. We also have an ongoing partnership with Henry Ford Health System. Again, we worked with FEMA, the county and the state. We partnered for our Sterling Heights Center. We also have an upcoming Ramadan night vaccine event on Friday,
yes,
April 16 from 8 p.m. To 1 a.m. And that has several partners from Wayne County, from Wayne Health, BOMA. I mean, there's so many partners, so many folks coming together to ensure that these events are successful and just, again, being able to accommodate to the community's needs.
Yes. Mona, how is the response? I know there is a lot of hesitation from many members of the Arab American community, and again, from the African American community, from the Asian, toward taking the vaccine. How is the response in your clinic?
So, we've had about, looking at our, data, which again, we're able to concentrate on our own data, but not the data of our partners because it's entered through different systems. But we've had about 30%, Arab Americans. So we are still continuing to provide the education. We do, monthly webinars. The last webinar, we got our doctors and faith community together to talk about, the myths and perceptions and attitudes around the COVID vaccine. And, it's really, we want to see more Arab Americans come out and get vaccinated. So we also know that there's a lot of hesitancy around the vaccine.
And why is that? Why is that? Why that hesitancy?
Well, if we look at, minority groups or immigrant and refugee populations, we know that there's a lot of mistrust,
Yes.
So there is, and then you have, again, misinformation going around, throughout the community. I mean, we've heard it all. There's nothing that you can share with me that I'll tell you I'm surprised by.
Yes.
So, for us, it's to kind of break down these myths and provide the education. And what I'm learning and what I'm seeing more recently, as you know, the cases here in Wayne County and in the Dearborn area are, skyrocket again. So
Yes.
we're back seeing that spike in positive cases. And so it becomes very, very concerning. And so the more people are, witnessing someone go through COVID, or, seeing the side effects and all of that. So a lot of people now are saying, oh my God, I lost a friend, or my friend has COVID, I want to get vaccinated.
Yes.
So we're also starting to see that side of it, where people are seeing more the real side of this, and, learning more that COVID, can be deadly if you don't take the safety precautions. And the thing is, what we're seeing is some people have COVID and they have very mild, symptoms. And then you have the other side is people who get COVID and get very, very sick, end up in the hospital, and some die. So who is going to do better than the others is something we can't answer. But we do know that you need to do everything you can to protect yourself and to protect the ones around you, because we just don't know. I've seen healthy people get COVID that didn't do well. We've kind of now, over the past 13, 14 months, we've learned a lot from what we have been witnessing.
Okay. Let's talk about the trust, and that's the main subject that this community have, about the trust for the vaccine. As you know, the vaccine, they've been doing the testing for the past probably 7-8 years till come. Tell me more about the effective and the safe of the vaccine.
So what we know is that the vaccines have now been studied, and they've been used for several years in personalized medicine, especially when you hear a lot about messenger RNA.
Yes.
So it's been studied before with other vaccines, such as the flu, with rabies and other similar, disease situations. So we know that it's safe, and there's thousands of individuals in each clinical trial.
Yes.
So when the FDA approved it for emergency use, it was based on the safety and efficacy of the vaccines.
After so many trials, right?
Yes.
Yes. Okay. Let's talk about some method in the community. They saying that the government put a tracking device with the vaccine so could follow the people where they go. Is that true?
Yes, we've heard, we've heard from the tracking device to, them being able to find out more information about, certain groups of people.
Yes.
We've heard about,
Is that true, though? Is that true?
It's absolutely not. If you just look at the information that the government is requesting,
Yes.
it's very basic demographic information. The government has made this very, very easy, and it's about the safety of the community and, everyone. So that information that is going around is just not true. There's no evidence around that. There's no reason to believe that. It's miscommunication going around. The government put out the vaccine for the health and the safety and well-being of individuals.
Is anybody die or get hurt bad from taking the vaccine, especially the Pfizer and the Moderna?
So I've done a lot
to your
of
knowledge,
reading. Yeah, so I've done a lot of reading, and every time I see an article out there, that somebody passed away after getting a COVID vaccine, I'm very interested in learning more about that. But this is what we know. We know that there has been cases where people, took the vaccine and then, unfortunately something happened. They have underlying issues, and there has been no scientific evidence to link that cause of death was
The vaccine.
from the COVID vaccine.
Yes.
So Wally, this is what we know. There is no scientific evidence. There's no correlation based on what we know, based on what, the readings that I have done, based on, the people that I've asked, because this is very concerning, and we want to make sure that we are delivering accurate information to our community members. But as far as I'm concerned, I have not seen anything that directly linked a death because of a COVID vaccine. Are there other underlying issues, other things going on? Possibly, but just based on what I know, I don't believe that is the case.
For a pregnant woman, and a lot of methods, they said, they put something to kill the baby, they want to reduce the population and all that. Can you tell me more about this?
So actually, we had our experts from Henry Ford Hospital who specialize in that area to address the community, because,
Yes.
I'm not a doctor. I want to make sure that they get this is about the health and safety and well-being of pregnant moms, and we want to make sure that they're safe. Or someone is trying to get pregnant. So we heard that as well, and that's why we conducted a webinar around it. And the doctors said that there was no linkage whatsoever, no evidence to indicate that the COVID vaccine causes any type of infertility.
I see. Okay, for the pregnant woman, don't you think they should need the vaccine more than other people because their immune is less when they're pregnant?
It has been highly recommended
Yes.
by physicians that pregnant women do get the vaccine. So again, not a doctor, but I could speak on what the experts have shared with us and information, according to the CDC website and our, government websites, and the information in terms of what are the experts saying. And the experts are highly encouraging pregnant women to get vaccinated.
Okay. Ramadan is coming soon, and how can somebody take the vaccine while he's fasting?
So that was another question that kept coming up in our community, and we wanted to make sure that we had our faith leaders to, address that issue, because, as you know, the culture and religion, and that's something that's very, very sensitive. And so the imams have, it's almost like a consensus, a shared consensus that the vaccine, someone does not break their fast if they get vaccinated.
I see. And it doesn't affect their physical because when they fast, they feel probably a little bit weak and all that. Would not affect that if he takes the vaccine?
Again, based on what our faith community,
Yes.
They're sharing that it's safe, and they are encouraging folks to get vaccinated. But I usually, anytime somebody has a concern, I always say, consult with your primary care physician. So again, I think it's important for people who have concerns, or, depending on their fasting and their health, that they should, consult with their primary care physician. But what was shared with us is that it's safe, and they were encouraging folks to get vaccinated, and that it does not have, the first dose usually, and it's kind of understanding the vaccines, right? And, what do people experience? So for the most part, we have seen very, mild side effects. That resolve within a few days. I mean, that's for the most part, that's what we have seen, and that's what we have heard from people who got vaccinated, whether it was their first, and now we started on the second doses.
Okay. Mona, as you have a lot of talent about the health, and you are the director of the community health, give me a message, a strong message to the community why they should take the vaccine.
The vaccine is so incredibly important, for one, for themselves and for their loved ones. So, there's also a lot of concern around, well, why should I take the COVID vaccine if they're saying I may get COVID again? Which, we have heard that people who have been vaccinated got COVID again. We don't know if they were exposed before they got their first vaccine. We don't know if they were exposed after they got their first dose. So there's still a lot of information there that we're still all learning. But what do we know from COVID vaccines? We know that people who are fully vaccinated, if they were to get COVID, they're not likely to get severely sick, and they're not likely to end up in the hospital.
Yes. Or
die from getting COVID after they're vaccinated. And this is extremely important. And the other part is the safety of our loved ones around us. Mm-hmm. As I mentioned earlier, COVID has been wicked in terms of its effect on different people, right? Some people came out totally okay. Some people didn't, and you just don't know.
Yes.
And this is a gamble as a community that we do not want to take. We've lost too many people in our community, and we've seen what COVID has done, this pandemic has done to our community. I've not seen anxiety and fear, and it really has taken a toll on people, people's mental health. And so we need to be safe. The vaccine is not the 100% solution to this pandemic. The vaccine is part of the solution, but we need to do our part. Even after we get vaccinated, we have to continue to wear masks. We have to continue to avoid large gatherings. We got to continue to, spatial distance and wash our hands and do all of the things that we started to do, because we still have a long way to go.
Yes.
And this proves that just this month. This started back in March in 2020, and here we are, 13 months later.
And it's getting worse. And
it's getting worse. And Wally, you talked about Ramadan.
Yes.
Last Ramadan, it really affected the Arab community, the Islamic, population who practiced, because they weren't able to break fast with their family members, and that's something huge during Ramadan.
Yes, absolutely.
And this year we're seeing that people are already, starting their gatherings and planning their iftar dinners. The weddings have started. This is all alarming. This is all very, very concerning, and our community cannot afford to lose another person.
Absolutely. Access is the leader of helping the community, the Middle Eastern Arab American community, if it's mental health, if it's work service, if it's need, and now the vaccine. And honestly, I talk to a lot of people, and I have a lot of knowledge about access. And I see access as the destination for the people who need the mental health, who go for vaccine, and honestly, that's a great job you're doing. The community should be very proud of Access, given this service in this COVID time, So we commend you for that.
Thank you, Wally. I really, appreciate it. And like thank you again. Access is working really, really hard. From the day this pandemic, hit the state. We were on the ground within a few days, providing COVID testing, transitioned all our services to remote, provided a number of different resources, just, kept staying connected with the community, because we know how these things can affect communities. And this is a global problem, not just,
Absolutely. Yeah.
Problem. This affected people around the world, and we wanted to make sure that we were there and that we were strong and positioned to serve our community. That's why Access exists. And, as the director of the Access Community Health and Research Center, I cannot be more proud of Access and the staff here and the devotion and commitment to this community. Like you said, it's been 50 years of service.
Yes.
And we just want to continue to ensure the safety of our community and make sure that our community has a safe place to go, regardless of the service, to get the services that they need. So that's why we're here, and we're very proud to serve the community.
And honestly, the community are very proud of you, and you become the destination for all the needies in the community. And you have your door and your heart open to serve whoever comes your way. So we thank you so much for that.
Thank you, Wally.
Yeah.
Thank you so much
Sure.
for bringing, awareness on this issue and providing this platform to educate our community and to let them know that, what services are available to them and where they can go to get services. This is phenomenal, and we thank you for that.
And we're going to continue to do the service and put, because this information that comes from you to the community, it's so important, because this is how the community responded coming to you.
Absolutely. Absolutely. And, when we first were working really hard to bring the vaccines to access, early on there was, of course, a shortage.
Yes.
And our community was calling us and saying, what do you think about the vaccine? Are you going to get the vaccine?
Oh, yes.
And then I was like, absolutely, I'm going to get it. Why are you going to get it? Because I want to protect myself and protect the people around me and my loved ones. And they're like, okay, if Access gets the vaccine, then we'll come to Access. So, again, it's that trust factor because they know that we wouldn't take anything that's harmful to us.
Absolutely.
Right? And yes.
And that comes throughout many, many years of serving the community and being honest and trust with the community.
Absolutely.
Yeah. Well, one last question. Do you have enough vaccine? Because I know the governor, she asked for more vaccine. So do you have enough vaccine for the people that comes your way?
So we were obviously struggling up front. When we were first awarded through the state pilot project, they gave us 2,500 doses, and the lines outside, the turnout was incredible, and we went through those very quickly. They gave us another 2,500, and so that's why we formed all those other partnerships so that we can continue to provide, vaccines for the community.
Yes.
I'm happy to hear that Access has been an approved vaccine site, going forward. So we will be working very closely with the state and, making sure that we have vaccines on an ongoing basis so that we can continue to provide, vaccines to our community members. The county has also reached out. They've been great. We've had so many community partners reach out to work with us to try to get us vaccines. Again, the turnout has been incredible. We're really happy to see the folks that are coming out and really want to make sure that the folks that still have questions, that they can pick up the phone, they can call. We're here for them. We understand this is, a sensitive issue for some people, but really just want to make sure our doors are open for folks to come and get vaccinated.
Great. What number they could call to reach you?
So the clinic number downstairs is 313-216-2200.
And we're going to put that on the screen so people, they could call, take it and call. Well, again, thank you, Mona. Thank you for all you and the Access for the great job you're doing.
Thank you so much, Wally.
Thank
Appreciate you and all that.
Sure.
Bye-bye.
My dear viewer, that was my interview of Community and Health and Research Center at Access. Mona Makki.